Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Happy Q&A day, everybody.
Hello, good morning, good afternoon.
And we do love celebrating wins in the program. So this week we are celebrating who started the program at 125 out of 132, which is very high, and was down to 13 in 11 months. So congratulations to, and then who started the program at 33 out of 132 was down to 11 in 4 months. So congratulations to both of those members. All right. Otherwise, we can start with our first question with.
Yes, I'm going to give you just a brief history so that you can answer my question. I'm 72 years old, pretty young for my age. 14 years ago, I had a serious head trauma that I didn't even remember that I had. And when I woke up 1 or 2 days later, whatever, I had symptoms and went to the doctor. They sent me to doctor after doctor. I lost my hearing in my left ear. I had double vision. I couldn't understand verbally and I couldn't communicate very well. My balance was totally off. And it took me some rehab and several months to come back to just a normal place of being able to care for myself. Moving forward, I've had some success throughout the last 14 years, but absolutely no answers from doctors. Of course, doing all the imaging and stuff, coming up with nothing, making me feel very crazy and all of that. And so, long story short, I came across your podcast and have just signed up. And I probably have had about 6 head injuries in my lifetime and several traumas that I never treated, never understood. I'm not ready to give up on life. I have a very positive attitude about turning lemons into lemonade. And I scored over 100 on the symptom test. So my question is, am I in the right place?
Well, so the first question I have is, you said you had a severe injury and you woke up 2 days later.
I didn't wake up. I woke up the next day, but within 2 days, I hadn't remembered what happened. I got hit in the head twice with a tennis ball, very severe, hard. And I just didn't have a recollection of connecting that to symptoms afterwards.
Oh, okay. Okay. So you weren't in a coma for 2 days?
No.
Okay. So, and your imaging, you said, is all normal?
Yes.
Yeah. So then, yeah, I would say you're in the right place.
Okay.
Because any type of more severe injury than a concussion, right? Brain injury will come in kind of 3 different distinct severity categories. So you have mild traumatic brain injury, moderate traumatic brain injury, severe traumatic brain injury. Mild traumatic brain injury, usually there's no loss of consciousness, right? 90% of cases don't have any type of loss of consciousness, but it can be up to half an hour. When you get into moderate brain injury, you're looking at loss of consciousness greater than half an hour, but less than 24 hours. Severe traumatic brain injury, you're looking at a loss of consciousness of more than 24 hours. Typically, with mild traumatic brain injury, you'll have no findings on imaging. So you have no loss of consciousness, right? You have a little bit of post-traumatic amnesia, potentially,
Yes.
where you forgot the incident.
Yes.
However, it still puts you in the mild traumatic brain injury category. You have negative imaging, which also puts you in the mild traumatic brain injury category. So that's exactly what this program is. Now, persistent concussion symptoms, as you may have already heard from some of the material you've gone through already. I don't know how far you're into the program or how long you've started, but
Level 2. I'm in the
right,
second. Yeah.
right. So concussion is the same thing as mild traumatic brain injury, meaning that there's no damage to the brain, which is why you can't see it on imaging. Okay? The symptoms that linger are due to just dysfunctions, other dysfunctions in the body. And it can be inflammation, it can be autonomic issues, it can be, gut hormone issues, it can be neck issues, it can be visual vestibular issues, those types of things. Those are all treatable. Now, the problem with mainstream medicine is that they don't really understand how this works. So they'll keep sending you for imaging, they'll send you to neurologists, but your neurological examinations will be normal. So the neurologist doesn't know what to do with you because you don't have any neurological abnormalities. The primary care may give you various medications because of the symptoms you're experiencing, but that won't get to the root causes. So this whole program and what it's designed to do is take the root causes that drive persistent symptoms and give you strategies to actually address them and fix them. So
Yeah.
this program is extremely effective for people in your MTBI, mild traumatic brain injury category.
Thank you. And I am also I joined a general trauma group whose information concerning mindset and all of that is exactly online with yours. So I have
Yes.
got lots of support right now. I
Good.
just had a fall a couple weeks ago, which re-triggered and reactivated everything. And I also have cataracts almost overnight. And of course, that's causing me a lot of trauma. But I am going to get that fixed. So thank you.
Yeah.
I thought I was, but I just wanted to be heard, I guess.
Yeah. I think your concern is valid because, it's been a long time. You're not really getting answers and you start to kind of think that everything is just bullshit.
Yes, yes.
So, but I will say that I think as you go through this, you'll see potentially different things, different ways of looking at it than you've probably experienced before. And my advice would be just to take your time and then make sure you implement the things in a gradual fashion, right? Your symptom score is over 100. You're not going to fix that overnight, right? It's just not how it goes. But as you heard from some of the success stories, and if you go on to the platform and look at the wall of fame, you'll see people that had really, really high symptom scores that were able to get those down even after 10 years of symptoms within the span of a few months. So just kind of stick with it, follow it slowly, don't be in a rush, because rushing just adds an additional stressor that actually prevents you from being able to recover. So you got to kind of just be slow, methodical, and patient. That would be my advice.
Thank you, thank you, thank you. And you've just confirmed everything that I have in my research with you that I found out. Thank you so much.
You're welcome. We're here for you, okay? If you need
Yes.
help, if you have questions, that's what we're here for.
Thank you.
You're welcome. Okay, next up is
All right. Hey, so I'll just keep like a brief backstory. So I've been dealing with PCS for over 10 years now. I joined, I've been on and off where I've been good and then I get re-triggered and I go back. About 3 years ago, I was re-triggered and I just never was really able to get my feet back under me again. And I joined your guys' program last year, and since then, I've been able to basically work my way up to 100%, where I feel great. I'm doing my things, and I'm like, man, I feel like I could probably start to reintegrate some of these things that I like doing. Um, and it's not like I'm trying to get into boxing or anything like that. Just normal daily things uh, like for instance, riding on like a jet ski or like driving in a sports car. Um, and yeah, it's just like I'll be at 100%, and then I'll go and try to slowly ease my way back into that, and it just will re-trigger almost. I mean, I just have such a low threshold. It's very strange how I can go from feeling so good to just I get re-triggered. So I've been trying to figure out if it's my sympathetic or my nervous system getting re-triggered into the sympathetic state, and that is just so easily uh, pushed that way just due to the balance of it, or if it's my eyes, and I'm starting to wonder if it's both. But I've done all the eyesight training and all that. And I don't know, like, it seems like when I'm feeling 100%, like, should I keep doing these eye exercises? Cause they're just so easy at that point. So that's what really throws me off. And then, it's been 10 years and I've been trying everything under the book. Um, and listen to you guys. And so about 3 weeks ago, I tried getting on, and I know you guys don't recommend this, but I tried getting on a a medicine to hopefully just keep my nervous system more calm. So I hopped on gabapentin, and it seemed like it was helping at first, like the first 2 weeks or so, because I did bump my head accidentally, not hard or anything, but normally that would trigger me, and I didn't get triggered, and I was like, wow, I think maybe this is helping. And then I tried just driving a car I have down the road. It was like a sports car, and just a 5 minute ride, and then that re-triggered me, and that was last week, and I'm still kind of crawling out of that hole now. So my question, I guess, is uh like, what do I do from here? Like, is it and one thing I do want to state with like the car, um, is when like the roads around here, about every 10 to 12 feet, there's like a small crack. So it's kind of like do, 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 when you're riding in a car with like a little bit stiffer suspension. And it's not like it's hard impacts or anything like that, but I wonder if that is like jostling my eyesight where it gets slightly off, and I wonder how I could train for that, or if it's my nervous system still, and if I should just hop off the gabapentin. I don't know. I'm just trying everything at this point, and like, I mean, yeah.
So, I mean, this is a really tricky one, but like the way I look at this is like the concussion cliff scenario, right? So you've basically climbed your way back up and you're standing right at the edge of the cliff and you're thinking, I'm 100%, but as soon as you do something, it just shoves you off the cliff again. So now the question is like, what do you do? Well, I think it's like it comes down to just building resilience in the system. So it's, is it your nervous system? Is it your neck? Your neck and your vision are very tightly intertwined. So, riding on a jet ski, for example, you go over a few waves, well, your neck does this, and if you're, tensing up, or you get in a car and you're, gripping the wheel, maybe you're kind of, driving it, to speed, you might be a little bit like, oh, and that might just tense your neck up. Neck and vision are related. So it could be that. It could be when your eyes are moving and trying to scan your environment, your neck is dysfunctional, and that's causing some of those symptoms to come back. It could be autonomic, where you get a little bit of like, excitement or sympathetic, and then all of a sudden it's kind of tilting you over again. So it's hard to say which one is the factor, right? I think the point though is that when you get to the top or edge of that cliff, you just got to keep doing the same things that got you there, which is hard to do because you don't really see the benefit in doing it, because you're like, well, I feel good. Why would I go and do these things? But that precisely is what allows you to like keep kind of getting yourself away from that edge, so that you do have a little bit more resilience, so that any little stressor that comes along isn't just going to throw you back off again. Now, that being said, I still think you should be doing these things, right? These are things that you potentially enjoy, and they're things that you want to get back into. And like you said, you're not, doing anything crazy. You're just going for a drive. I think all of that is almost therapeutic in a way, right? Like you said, the eye exercises don't really flare you anymore, but maybe getting in the car does. So that's maybe just the next step for you. And I would encourage you to kind of keep doing that, right? And try not, when the symptoms increase, try not to spiral and like get worried about it, because then what happens is then it just continues to feed on itself, and it makes it harder to do, harder to get out of it. It just makes a small little bump into a bigger hole that is harder to get out of. So that comes down to the tools you have from Melinda's section of being able to kind of calm things down when in the face of symptoms. But every time you do it, it should be kind of improving. You might be able to do a little bit more, a little bit more, a little bit more. You might start with a 5-minute drive, and then eventually progress to a 10-minute drive, and eventually to a 15-minute drive, and 20-minute drive, and 30-minute drive. I think that's all good. That's all challenging your system. I think that's a good thing, right? So having a little bit of a symptom flare, like even when we do the rehab exercises, right? If I tell you to look at a spot and turn your head side to side, if it doesn't flare you up anymore, what do I tell you to do? Go to the next level, right? Go from 10 to now 20. Okay. Oh yeah, that now flares me up. Good. Do that until it doesn't flare you up anymore. Then go to the next level. So the same thing, getting behind the wheel of a car and it flares you up a little bit, that's a good sign.
Yeah.
Right? You want things that are challenging you a little bit. You don't want to overdo it. You don't want to do it to the point where you're just completely screwed up. But like, how long was your drive? Let me ask you that.
Probably 5 minutes. And the day before, I drove down the road and back in it, and it was probably a 2-minute drive, and I was fine.
Yeah.
So yeah, I mean, and I've been doing that. I've been trying to just, I start and I work my way up, but then it's just like, as soon as I go over that 5-minute drive, I mean, it set me back a week now, and I've been brain foggy. And with this one, it's different because it feels a little bit more vision. Whereas, like, say I'm golfing and you're just driving across the grass in the golf cart and you hit a small bump, and that would sometimes flare me. That's happened to me a couple times where it's just one bump in it, and then that's when I feel like that's my nervous system. Whereas this time it feels like it may be both, or it might just be my eyes,
or your neck, because your neck causes a lot of these visual type of symptoms. The neck could be the thing that causes flare up when you hit a bump too, or it could be the nervous system, or it could be a combination, because neck dysfunction and autonomic dysfunction go hand in hand too. Right. So it's like trying to figure out which one it is, you'll drive yourself crazy. I think what we have to consider is that it's all of them. But what got you to the point of feeling really good? Let's just keep doing that while also continuing to challenge yourself like this. Right? Keep working on the strategies, keep challenging. Keep working on the strategies, keep challenging.
Yeah. So do you think I should wait now until I come down before I start trying to integrate these, driving a car for, say, like this? I mean, I can drive normal vehicles. I just can't,
It's just these types of cars with stiffer suspension?
Yeah.
How long can you drive in a normal vehicle?
I can drive. I mean, I could go anywhere. I'm just fine. It's literally just these type of vehicles that I like, or at least used to. Now I don't like them that much anymore, but I still want to try them.
How much do you worry about it?
I mean, I feel like it definitely worries me, but also, like, I don't know. Like, I feel like at the same time it doesn't. I don't know. Like, I'm just so used to dealing with this.
Because sometimes if it's like, a highly anticipated thing, right? I haven't been able to get into my sport course. right? Then our nervous system's stressed out. That means
Before we even do it.
before you're even
Yeah.
doing it.
Yeah.
And I feel like I have this memory of you chatting with us about this, where you had shared with us that it was, you could even feel the nervousness before getting in the car.
Yep.
It was that, yeah. So
Yeah.
I remember thinking, when that happens, right, and this happens for a lot of people, your nervous system's you've already been like bumped outside of your window of tolerance, or you've already gone over the concussion cliff before you even do this activity. So the fact that you can drive other cars versus sports cars, I get that there's a difference in how that feels for your body and your neck, but it's a 5-minute drive. You're not going at a high speed. I'm not hearing there's a lot of like bopping around. It's
I'm
just,
just driving straight.
so I'm just curious whether you could try on a theory of anxiety and say, is it really my anxiety that creates more sympathetic drive in my system that creates symptoms before this thing even happens? Right? I'm hearing there's specific triggers versus, other things would potentially flare up this, someone that didn't have anxiety. So I don't know, Cam, what do you think? Like regular car versus suspension?
It's
Yeah, I mean, I think that like,
A theory to
because
try.
when you think about even just like, G forces, right? Like even on a stiffer suspension, it's like maybe you're getting like 1.2 Gs. Like you're not
not even
getting like a
close.
substantial amount of forces. But maybe like just thinking about like an exposure type that
Yeah.
therapy situation is like if you're already feeling yourself getting a little bit anxious before you go for the drive, why not just go and sit in the car and like don't drive it? Like that's a starting point. You just go sit in it just to like get your body used to just like sitting in the car. Then maybe you start just turning it on and literally just idling it or revving it while you're sitting in it, right? Just like very gradual. And then maybe it's, going for 2 minutes, because 2 minutes you said was fine. But maybe
Yeah.
just doing that for a while, just going and getting in it and that routine maybe reduces the anxiety that you have before you go. I don't know. Melinda?
Yeah, no, and I was doing that this spring actually, and I should just go back to doing that. I agree. Or I would go in, I'd do deep breathing and tell
Right.
myself I'm safe. And you're right, Melinda. Honestly, you're like I do get nervous, but like before for
Understand.
sure. Just because I don't want to like it's like now I've had a week of this and it kind of ruined my week.
And it's also been 10 years of dealing with this shit. Like
Yeah,
it would be insane for you not to have some anxiety around setting yourself back. Right? You've been 10 years and now you got to a point where you're finally like feeling good. That like it's only natural to want to like hold on to that and not fuck it up.
yeah,
And
yeah.
so I think that that's completely a normal thing.
I think exposure therapy is probably the place to go. And sometimes even working directly with a mental health provider can actually create a very tailored plan for exposure therapy because do you remember the concept, the window of tolerance? It's kind of like the concussion cliff, but it's just for our emotional capacity. So in the window of tolerance, we can know when we're in our window of tolerance where things are just feel okay, right? I'm doing well. I'm resilient against stressors. But if we creep towards the top of the window of window of tolerance or the bottom, what we're noticing is that our nervous system's starting to get activated. Now, on the top end, that's anxiety, overwhelm, panic, worry, rumination, etc. On the lower end of the window of tolerance, that's sort of like depressed, low, shut off, numb. And the sort of point of exposure therapy is to help us expand our window of tolerance. And so, what a mental health professional would help guide you to do is to only engage in those triggering activities when you're in your window of tolerance, not when you're on the edge, not when you're outside the window of tolerance. So, sometimes we don't know that about ourselves, and it takes a while to sort of build those skills. So, what I'm wondering is if sometimes you hop in for that 2-minute ride and you had a great day and you're in your window of tolerance, but the next time you might already have this baseline of anxiety that's bumped you out of your window of tolerance. Now you're spiraling for a week afterwards. So it's sort of like
Yeah.
how to set up the exposures that might be important for you to get through this last hurdle. That's something that would be done with regulated mental health professional, because they could really tailor it to the specific issues. And my instinct right now, if you were a client sitting in front of me, is to really get into the specifics around what happened that day, what was going on the hour before you got in the car, what were you feeling, what was your mood like, what was happening in your life, because all those things matter before you do an exposure. So I think that because it's tricky and it's not everything anymore, you've made lots of progress, you feel at 100% a lot of the time, I wonder if doing something with support of a mental health provider for exposure therapy will help get over this last hurdle. Then it's really building self-awareness. When is it a good idea for me to do this? When should I not do this? Or when do I need to regulate myself before I go on a jet ski or get in the sports car?
Right. No, I think that's good insight for sure.
Usually it's like 8 sessions. You can, with a mental health provider, you can create some movement. So it's not like a year-long commitment, although that could be very helpful too. But you can generally create some movement there with a brief round of exposure therapy.
Okay. Yeah, I'll look into that. And as far as like the gabapentin, like what do you guys think? Like, I mean, I don't know. I just wanted to try it and see if it would help. Should I don't know. I meet with my doctor next week, so to like see, go over whether it's helping or not. Should I hop off it? Should I I don't know.
Are you on the lowest dose?
Yeah, I believe so.
So just the one thing to keep in mind with stopping medications, if you're at the lowest dose, it'll be easier. But if you've titrated up on the medication, going off of it generally creates more anxiety for a certain time period. So just keeping that in mind, if you do decide to go off it, that it's likely your anxiety would rise for a little while. Not that it's permanent, but it's just the withdrawal effect that's normal.
Right.
On those medications. So not to be spooked by it and think, oh no, I have to be on it. It must have been making me so much better, but more, oh, I've just taken away something that was dulling and numbing my anxiety. And now I'm off of it. So I'm going to feel that more. So you'll have to give that a good amount of time if you do decide to go off of it.
Okay.
How long you been on it for?
I mean, 2.5 weeks now, maybe. I don't know. 2 to 2.5 weeks.
So that's a very short period of time. So a couple of things with these class of medications. It sounds like it was prescribed as well, we don't really know what else to give you, so we're going to try this. I find it works probably the best for situations where there is some sort of chronic or neuropathic pain. Yeah. So usually some sort of neuralgia, neck pain, but it's more nerve related. If it's like regular neck pain or the symptoms you described, I don't think it's going to do you any favors in that sense. Secondly, it's sometimes prescribed for people that have anxiety because it has some anti-anxiety effects, but it's rarely ever prescribed as first line for anxiety, meaning the first thing that you should try. That's usually a different class of medications. Thirdly, this medication does require a titration up of dose to find the right effective amount. So the lowest dose is rarely effective. It sounds like you just started that, so it's really hard to know if that's actually doing anything. So, I mean, I know we're not your docs, so you're going to have to kind of take what we all said, myself and Melinda, specifically on the gabapentin, and see if you can make heads or tails of that and decide what to do. Have a conversation with your family doctor to be like, okay, what are you hoping to achieve with this? I think what Melinda said, some of the mindfulness stuff is much more effective. I even think some of the more nutraceutical herbal stuff is more effective for addressing the anxiety component if that's your main issue. If you also have chronic nerve related pain, then it's maybe worth a trial. And then finally, this medication is not without its side effects. One of them is weight gain. It's a pretty common thing that happens. And also, interestingly enough, cognitive dysfunction. So there's an increased risk of potentially going down that route, which, it's kind of like one of those like short-term benefits of people's nervous system so amped up, maybe they can bring it down. Long-term side effects are problematic. So anyways, hopefully that is some additional info for you.
Yeah. Yeah, I was hoping just to kind of, I didn't want to stay on it long, but maybe this would help me at least get my ground, and I could start working, building my threshold. But yeah, I definitely I'm not a medication kind of guy. This is really the first time I've ever been on anything, so it just was trying it.
You kind of have to go full commit. Like if
Yeah.
you're really going to get the benefit, you got to go all in. So 2 weeks is not enough to know one way or the other. So I think if you want to keep trying this route, then you got to go all in on that. And or now's a good time to also stop it because you're just starting it and try something else.
Well, yeah, I'm thinking almost combination therapy with like an anti-anxiety medication, and mental health therapy is highly effective. So instead of gabapentin, if you're not experiencing nerve pain or chronic pain, I might have missed that part.
Oh, that's right.
Just a low dose antidepressant or an anti-anxiety that focuses specifically on like rumination and worrying, plus working on that exposure therapy with a mental health professional. That has a lot of good research behind it. Combination therapy can be highly effective if you're already leaning towards the idea of a medication. That could be an option. I think we're all kind of curious about why gabapentin was prescribed, but of course we don't know everything about your case.
Right. This little graphic I'm showing here is a whole bunch of different mood antidepressants. Antidepressants also are used for anti-anxiety. Really common ones are citalopram that I see a lot in my practice. Other ones that also have kind of like the nerve overlap is something called Effexor, venlafaxine, and amitriptyline and nortriptyline are also really common ones. You are not on this one, so gabapentin does not fit in the antidepressant category. But just so you know, there's lots of different effects on weight. This is just some info I was putting together on medications that impact weight. But I think you have some food for thought. Okay.
Yeah, absolutely. Thank you guys. Really
You're
appreciate
welcome.
it.
No problem.
You're welcome.
Keep us posted.
I will.
Let's move on to the next question.
Hi, yeah. So for a bit of context, I've been doing the program for 4 months now, making quite like slow but steady progress. And I would say a few weeks ago, I was feeling like 75% better. I was able to do a lot more. I started my phased return to work, following the specific guidance from the program, but on like the condensed 3-month version rather than 6 months. And it was going well, and I was like, I almost tricked myself into thinking I was cured. And then this past week, I've had a huge flare up, which kind of got worse for a few days, and now seems to be maybe getting a little bit better, but still isn't good. And I've found that I'm having to like go back in terms of what I can do again a lot, and especially with the exercise. I was following the treadmill test, exercising at a certain range between 130 and 140 beats per minute. I can't do that now, so the last few days I just haven't exercised at all, and I've stuck to walking rather than going to the gym. But it's just that in terms, where do I really go now in terms of trying to get back on track? I don't want to go right back to the start and stop doing everything again and then have to build up. It's really hard to know. Yeah, it's hard to know how to reintegrate things, and it's also frustrating not really knowing exactly what has triggered the setback. I assume it's just because I started doing a lot more again and I returned to work, which probably sent my nervous system a little bit haywire. But yeah, basically where I go from this flare up forwards a little bit.
Okay, so where are you at with return to work? Like, how much are you doing?
I'm doing I've done 3 hours on Monday, Wednesday, and I'll do 3 hours tomorrow. And then next week I'm going up to 4 hours on those days. So like week 2.
Okay. Do you think that has something to do with it?
Yeah, well, it must do. It's hard because it didn't happen immediately after working. It's almost like I wake up one day and the symptoms are back, rather than it being clear that it always happened whilst I've been at my desk. So it's hard to pinpoint exactly.
You said they happen while you're at your desk?
No, they come on kind of at random points, not usually directly after the activity.
Right. So I mean, these things happen all the time, right? This is kind of part of the concussion recovery. It's kind of this, right? Like you got to think of it like the stock market, right? Like it does this. Generally the trend is up, over time, but there's going to be some times where things dip. And I think that, we've talked about this before, it's kind of like your mindset towards that dip, right? If we start panicking and getting freaked out, and then all of a sudden we don't sleep well because we're anxious about it, and then that's what causes a really big pullback. So you first want to make sure that you have the strategies in place from a mindset perspective to be able to kind of calm the nervous system back down when faced with a setback. So you're like, oh, okay, my symptoms are flaring. I need to just reset. And how am I going to do that, right? Well, I'm going to do all the strategies kind of from Melinda's module to try and just establish a base, right? And then once you establish that base, then you can start kind of building back up. Now, it's not like you have to go all the way to ground zero again. You might pull back slightly, right? From an exercise perspective, maybe you start with 120 to 130 beats and do that again. And then go right back to 130, 140. It's not like you have to go back down to like, 90 beats a minute, right? So sometimes these little kind of setbacks just mean you just, and it's okay to take a day or two off. You know what? I'm not really feeling great. I'm not going to do my exercise today. I'm just going to kind of relax and like reset, work on some breathing, work on some meditation, try to just calm things down, maybe just go for a nice light walk outside, things like that to just kind of reset. And then when you do get back to exercise, say, okay, well, I was at 130, 140. I'm going to start gradually, right? It's the same thing with like, I don't know if you like lift weights or anything like that, but like if I'm at the gym and I'm lifting a certain amount and I take a week or two off, like let's say I go, on vacation or something for a couple of weeks, I don't go to the gym. I come back and like my weights have dropped by like 10% at least. Right? So it's like you really lose things quickly. So even just taking a couple days off, that's perfectly fine. But then when you come back, just lower it a bit and start, there, and you'll quickly get back up to where you were. Does that make sense?
Yeah. Yeah, that does, and that's really helpful.
Now,
I think go on.
the other question I have for you though is like you're trying to accelerate the return to work. Is that an added stressor, do you think, for you?
Maybe it is subconsciously. I wasn't feeling stressed about it because I was feeling really good when I returned, and like my first week back, I was feeling really good. But I suppose now that I'm flaring again, I am feeling stressed about the accelerated version. But I don't have much choice. Like my employers can't support the 6-month version, but
Right.
would support the 3-month version.
Right. I mean, maybe it's a case of starting slower at the start and accelerating after things are better. You know what I mean? Like going 1 week at 2 hours, 1 week at 3 hours. Now you're moving to 4 hours next week and you're already starting to experience a flare. That's why maybe at the start, it's like, okay, let's go 2 weeks at 2 hours, 2 weeks at 3 hours, 2 weeks at 4 hours. Like, because then it's just such a much more gradual step. And then after a couple months, maybe now you're going, okay, now I'm going to accelerate the last part of this because you've kind of built up your stamina. You've proven to yourself that you can do it. You've done it in a way that's nice and slow and controlled so that you're not freaking out about it. That's why it works a lot better. And when you try to accelerate it, it can just basically make it worse because you're trying to make it faster, but ultimately you end up getting slower, right? The tortoise and the hare, right? If you're going to try and be the hare and go quickly, you're going to end up having to take a big break.
Yeah, I'll see if they can support that a little bit. I'll speak with my manager and see if they can support slowing it down and doing another week at 3 hours.
Like ultimately it's better for them because they get you back quicker. Because if they try to rush it back, they end up losing you again for another 2 months. And then they got to find a replacement or do whatever. You know what I mean? Like it actually makes it worse for both parties. It makes it worse for you and it makes it worse for them. So hopefully you can convey that like by going slow and gradually, I'll be back full time sooner than if we do these fits and starts.
Yeah. Yeah. No, that makes total sense. And I suppose the other part of it is with the flare-ups, with like the autonomic dysfunction, when I'm having a flare up, so this week, for example, I would meet the threshold for POTS. Like when I stand up, my heart rate definitely rises by the 30 beats per minute. But then when I was doing well and like not having a setback, it wasn't doing that. And it is a bit of hit and miss on the day. Each day could be a bit different. So it's hard to know then with returning to exercise whether to follow the normal protocol or like the POTS protocol, because each day it's a little bit different. So yeah, what do you think about that?
So post-concussion POTS seems to be different than like true POTS. So like true POTS, like that comes on for other reasons than concussion, right? Usually it's idiopathic. It comes on for, no apparent reason. Generally it's, teenage females. That's kind of the main, people that get POTS. After concussion, POTS symptoms like you're experiencing tend to be related to concussion symptoms. As concussion symptoms go away, the POTS goes away too. So this might just be that as your symptoms increases, you start to show signs of POTS. It doesn't mean you necessarily need to follow the POTS protocol. We just need to do things to get your symptoms back down. Okay?
Yeah.
But I would still do the POTS type things. Hydration, electrolytes, trying to prioritize sleep, trying to, do regular exercise, breathing exercises, things to calm your nervous system down, right? Like even just grounding exercises and, belly breathing, box breathing, those types of things. That'll all help both the anxiety and the autonomic system and help to kind of establish that base to stop this setback from continuing on. I see Melinda keeps unmuting herself, so she's been just chomping at the bit here to get in.
You're sharing what I was thinking as well, Cam. The one piece I wanted to mention, which Cam just introduced as well, is when you start to feel symptomatic, with the return to work, one of the most important things is simplifying whatever's happening at home. So I don't know what your life is like outside of this return to work, but a lot of times a more successful return to work does depend on simplifying what other demands you might have going on at home, because the input, the amount of energy needed for you to sort of successfully return to work is sort of being chewed up by just the return to work itself. So it could be helpful, if you haven't already, to assess sort of what are your responsibilities at home, what are the things you're doing outside of work, and give yourself 3 to 6 weeks of while you're doing the graduated return to work to simplify the rest of your schedule. And then within that, as Dr. Cam already mentioned, really bringing in the nervous system regulation. Walking, right? Walking is really going to support your autonomic nervous system. So things might look a little different, more like you're back into the rehab loop while you're returning to work, but it's just in order to offset the added stress of return to work, and really being mindful of other stressors that might be going on outside of your return to work plan.
Yeah, that's really helpful. I'm actually moving house in 2 weeks, so I think it has been like there is stress going on outside of the return to work. So I think that's definitely adding to it. So yeah, I'll see if I can strip back everything that isn't essential.
And that's any big stressor that's going to be happening outside of your workplace alongside your return to work is going to put you at a higher risk of having a PCS flare. So I don't know if you can have a great team of people to help you move and really be hands off, or take a few days off work to allow that to happen. But moving is one of the top stressors outside of concussion. So knowing that you have that going on, it's not surprising that you might start to feel some of those symptom flares. So I know, you're probably an inescapable thing that's going to happen for you in 2 weeks, but moving forward, just being highly mindful of what things you end up doing in your personal life while you're trying to reintegrate into work.
Yeah. Thank you.
Yeah. My bet would be the move is the trigger here. Going back to work and the move combined, all of a sudden it's like overwhelming. And then there you go. There's your current flare.
Yeah. Yeah, it does make sense when we lay it out like that. Yeah. Thank you.
You're welcome. This too shall pass.
Yeah, so it's been a long road. I think that one of my main issues is that before my concussion, I already suffered with anxiety and trauma, and I think recovery has been it's been a journey. Um, One of the questions I have is about my sleep, actually. So I focus a lot on going to sleep, hygiene strategies, everything. I also take amitriptyline, 10 milligrams, which in the evening has gone up to 30 at times or 20 because of stress as well with life. So I've also noticed that some nights, even with that, I won't be able to sleep. So it's a bit tricky. I wondered if you have any thoughts about that. I feel quite moved. I think it's because I'm tired. Um, but yeah, it's been a lot about regulation and calming myself. I also have therapy, but it's challenging.
Yeah. Okay, let me ask a couple questions here for clarification. With sleep, do you have issues with initiation or is it maintenance of sleep? Are you waking up?
It's both.
Okay. How long does it take you to fall asleep?
Sometimes it will be really quick, and other times it will take me a long time. So I do breathing exercises and
Okay, take your time. Do you feel like there's any sort of anxiety or running thoughts that are disturbing your ability to fall asleep?
I think it's probably haven't gotten used to actually being in this mode. So despite breathing and everything like that, I think it's like the nervous system is used to being in worry mode. Um, and some nights I can sleep, so it's really interesting. Some nights I sleep very well, like for 8 or 10 hours, and other nights I can have like 2 or 3 nights, and especially with the cycle, 2 or 3 nights of no sleep. It's
Hmm.
really fun.
Do you notice that there's any sort of impact on temperature fluctuations or what someone might
I
term?
usually do things like having the temperature of the room um, very cool as much as possible. Sometimes I've even put the fan during the summer so it keeps cool. Um, I try not to have snacks or caffeine, anything like that. I don't have at all. Um, and also sugar. I really avoid it big time because that leads to loads of fatigue. Um, so it's like it's really frustrating because it's like I've put all the things I can in place, but it's still difficult. It's exhausting actually. It's very tiring.
Of course, if you're not sleeping, you're going to be very tired. Absolutely. Have you looked at the sleep module that I've created, especially in the 2.0 version? Did you work through that yet?
Thanks. I've got to the part of nutrition, that's where I am. So it's been a slow one. So I don't think I've come to that yet. Am I right?
So sleep actually in the new one is before nutrition. So
Oh, okay.
are you working through the old course, or which is still very good? It's just we've recently updated a lot of the information and built out.
Right. Okay, that's really good to hear. I didn't know that. I wasn't aware, but yeah, that's good to know. So does that would mean I'm probably working with the old one then.
Yeah,
Yeah.
maybe. Go to the one that says 2.0. Like when you go to courses, go to Concussion Fix 2.0.
Okay. This is ridiculous. Thank you so much. Yeah,
Yeah.
I'll do that.
Yeah, so
Yeah.
you know what? It actually is not, this is a blessing in disguise because the 2.0 version, especially Melinda's section up front, which is the first thing, if you're dealing with anxiety, it sounds like the fluctuation of sometimes getting a good sleep could be related to the way that your mood is fluctuating, whether there's high levels of anxiety that are present. If you're having issues with initiation and also sleep maintenance, it could be multiple factors that are happening at the same time. So I actually think it's a good idea for you to go back and work through Melinda's sections again. And really, we've reordered the course a little bit to the point that we've put the sleep section before the nutrition section, and we've also put the gut brain nervous system vagus nerve regulation section before the nutrition section, when before we did that after. So I think it would really serve you well to go through that and just really try to implement each one of those areas, because in the sleep module I do talk about magnesium. I do talk about saffron, which is a new addition. It was not talked about in the 1.0 version, and also melatonin. Melatonin can be very helpful for initiation of sleep.
Yeah, absolutely. That's really interesting because I've also done a bit of herbs and valerian and things like that, but even that hasn't been helping me with actual sleep, like getting into a routine of actually sleeping every night well. So, can I ask another question? And I know that this is probably, I know I need to focus more on regulation and sleep, so I'm aware of that. But my neck is also very tense, and obviously this makes sense because if I'm tense and when I have anxiety, the neck is gonna receive that tension as well. Um, but I wanted to say, like over the years, I would not put my neck or back in any professional kind of massagist or anything like that because I was oversensitive. So things have got better in that way. But now I feel that my neck, I've had a massage already by one or two people, and I feel more confident with doing that now. I just wondered because I've looked at the Complete Cushions website, and the closest person with helping on that, with if I understand correctly, with Cameron Marshall's support, they're like 2 hours and a half from where I live. So I'm not sure who exactly, and it's quite expensive. It's like in pounds, it's £160 for each session.
Which clinic are you looking at?
So that is the St. Albans Healthcare Clinic, and it's with Jonathan George. And it says first 3 appointments are 90 minutes for £160 each, which is a lot of money, and then follow-ups are £70. So I know that I feel I could do with a bit more, hands-on on my neck area, because it's really painful at times as well in my back. And I know it contributes for my migraines as well. These things are all interlinked. I really get that. But considering this is so far, would there be any other options that I may like to consider and that could help?
You're in the London area, I'm guessing?
I'm in the southeast.
Southeast, yeah. Yeah, we've talked to a bunch of clinics over there, but nobody seems to...
We're all in denial.
Well, it's funny because you talk to clinics in the UK, and the UK is like so far behind with this. It's actually crazy.
Yeah.
You talk to clinics in the UK and they're like, well, we don't see concussions. And you're like, well, yeah, do you have a concussion program? No. Well, what makes you think you're going to see concussion patients if you don't actually have a concussion program? But that's the mindset. It's like, well, why would we get training on concussion if we're not seeing concussion? And they don't realize that there's people like you that are like, I have to drive 2.5 hours to see somebody. This is crazy. So I would say that that's probably not worth your time. Now, the reason I say that, like, the good thing about Complete Concussions, obviously, is that they know how everything fits together. So they'll be able to run a proper treadmill test. They'll be able to do visual, vestibular, and neck and kind of see how everything relates and give you a proper kind of rehab strategy. Now, if you're just looking for like someone who's good with the neck and it's like you've pinpointed that it's neck, I'm not sure that you have yet. And to be honest, in your situation where you're kind of still early, right? Like what we say is don't get rehab until you've kind of built your foundation, because it's not going to be as effective, right? If your nervous system is still out of whack and you're not sleeping well at night, like going and getting neck work may just flare things up and may not give you any benefit. So we always like to have that foundation pretty solid before we then go to rehab, which is the last step in the process. So given how early you are, I wouldn't really be looking for this yet anyway. But once you've kind of built that foundation, you'll have a better idea as to what's actually behind the issue. Is it neck? Is it visual? Is it vestibular? And I think it'll be way more clear because in the program, once you get to that section, there's like self-assessments.
Yeah.
where you can kind of run yourself through some self-assessments to figure out, oh, this causes some issues, so I'm going to start doing this first. Okay, this doesn't cause me issues, so I don't have to worry about that. And it'll kind of get you to a point where you'll go, oh, this is like the one little piece remaining, and then it'll be much easier to figure out who you need to see at that point.
Thanks. Yeah, I really get that, and I really appreciate it too. It's all food for thought, and I guess it just involves a lot of patience, and that's part of the process as well.
Yeah, if you're finding benefit with the massage, then I would just keep doing that. I wouldn't worry about going 2.5 hours out of my way unless you've really figured out, you've done all the foundational stuff and you realize that like, okay, this is like just this one little piece, then maybe it's worth making that trip. But I think at this point, because we haven't really got that good foundation yet, I wouldn't go out of my way to do that.
Thank you. That's really helpful.
The drive alone, right? 2.5 hours there, 2.5 hours back, you're going to undo every piece of progress you make anyway.
I know, and it's also
right?
very expensive because there's petrol and
Of course.
yeah.
You got to somehow get yourself around London traffic and all that. Like, come on.
Exactly. It's really challenging. It's a shame also that in the UK there is very little support indeed. You're absolutely right. And
I mean, we're pushing hard in
I
the
believe
UK.
so,
Like,
yeah. Me too.
yeah, we're pushing in the UK. We have some, partnerships kind of starting, so we're trying to make headway, but it's just like the education is so far behind, right? Like a lot, especially in the sporting world, everyone still considers it, well, it's just a knock on the head, you'll be fine kind of thing, and nobody really takes it super seriously yet, which is crazy because there's so many people from the UK that are trying to find treatment, and we're trying to find clinics to treat them, and the clinics are saying, well, we don't see concussion. So there's this disconnect here, but hopefully we can get to a point where we have it like, Canada, where there's 200 clinics. And then you can go in your own town. Why isn't there one in your town? There should be.
Yeah, totally. Right, completely. I won't even get started on this myself. Yeah, as a patient, it's challenging. It's really challenging.
Well, I mean, the NHS is a joke too. Like, it's hard. But anyway, I would say if the massages you find are like helping, just keep doing that for now, and then just keep working yourself through the 2.0 version. Because then I think it'll be really clear at the end of like, you might not even need anything. A lot of people get through the program and they realize they didn't need rehab to begin with because all the other stuff was just the foundational elements. And once they've tackled that, everything's gone. But you might get to the end and say, well, there's still this little lingering piece, but it'll be very clear as to which it is. And then now you'll know what to do.
Thank you. I really appreciate that and your time and energy, all of you. Thank you so much.
You're welcome. Okay, Nikki, we want to go to the chat now and then call it a day?
Yeah, absolutely. So just a couple of things here. So I've always been sensitive to motion sickness. Can't look at a book or phone in the car longer than 2 minutes or I'm car sick. Have always been this way. I remember, Dr. Marshall, a long time ago, you mentioned something about taping glasses and motion sickness. What can I tell my optometrist for this? My vision is fine otherwise. My glasses prescription hasn't changed. I do see chiropractor also, who's excellent. Anything specific I should tell them to work on also to help with this?
So what you're talking about is something called binasal occlusion. And I do cover that in the program, in the kind of vision rehab section. So basically that's for visual motion sensitivity. Car sickness is often due to visual motion sensitivity. So this is more of a Band-Aid than a treatment though, right? What this does is maybe I'll just share my screen just so that it makes sense for everyone else. Hold on a second. Let me find this. Okay. Now, which module is it in here? Visual motion sensitivity. Here we go. Share. All right. You can see that?
Yep.
All right. So basically we have 3 techniques for this. One is, desensitization or habituation maneuvers, basically exposure, right? You have difficulty in crowd or in cars, ride in cars more and gradually increase your tolerance to that. Tinted spectacles, like sunglasses, for example, just because it's letting less light in, there's less stimulation. Binasal occlusion is this. So basically, each of your eyes is providing 2 copies of information, right? So you have, or each eye is providing a copy of information. So everything in your peripheral field over here is basically coming from this eyeball and this eyeball, right? So you're getting basically 2 copies of things in your peripheral visual field. Binasal occlusion, you basically just put a string of clear tape, so like, medical tape that's kind of, frosted. If you know that kind of medical tape you can get at a, pharmacy or whatever. And basically what you do is you just tape the inner 1/3 of the glasses. And sometimes it's straight up and down. Sometimes they go on a slight angle from, from down to up. And you just put that over the glasses, because basically what that does is that cuts off 1 copy of that peripheral visual information input, right? So this right here is blocking this peripheral field. You're still going to get the peripheral field from this eyeball, but you're blocking it from this eyeball. Same thing this way. So what it does is it takes having 2 copies of the information in your periphery down to only having 1 copy on each side. And that just can calm things down, and it's less stimulatory, and people often feel a lot better. So it's just something to use in the car if you're really struggling, right? This is a Band-Aid. This is like taking a medication for a headache. You're not getting to the root cause of why that's occurring. You're just being able to buy yourself a little bit of extra time. Like if you have to go on a two-hour road trip and you get really, really car sick, then doing this can kind of maybe extend your ability to be in the car before you start throwing up. Sorry. So that's all it is. It's kind of a Band-Aid. Now, a lot of people with visual motion issues, it's actually neck related. So especially if you've had pre-existing motion sickness in cars, like before your injury, if you've always been motion sick, a lot of times what that is neck dysfunction, because your eyes are constantly relying on input from your neck to tell you where you are in space. If your neck is dysfunctional, the input to the eyes is off. And so the eyes don't know what to do with that information. And then you feel this disconnect, and that's what makes you feel dizzy, nauseous, sick. The example story I use on this is my sister-in-law. My sister-in-law has been motion sick her whole life, never been able to be in cars, always, even as an adult, would have to like pull over multiple times in road trips because she'd be vomiting. And I said, you should get your neck looked at. And so she went to a colleague of mine. He treated her neck a couple times with ART. Now she hasn't been motion sick in years, right? So it's a lot of times it's a neck dysfunction. I'm not saying every time, but a lot of times it's a neck dysfunction issue. So if you have a good chiro, some ART, that's probably going to get at the root cause of what's driving it, right? In the meantime, you can wear your binasal occlusion as a Band-Aid solution to be able to get you farther on road trips.
Perfect. There's a question here regarding the 2.0 course. Also, it has been just over a month now since we launched 2.0, which is awesome. And so they're almost done the original course, and then also looking, if they're going to lose access if they switch over. So I just want to reiterate to everyone who is listening, if you are almost done the original course, and the thought of moving over to the new course causes stress, anxiety, continue in the original one. The whole, we don't want to increase anyone's stress, increase anyone's anxiety, anything like that. The original course is amazing. We have helped thousands of people with it. The new course, however, just has 5 years worth of questions and experience that we've taken into account and added into the new course. So Dr. Marshall, Dr. Hrkal, and Melinda have done an amazing job of redoing it all to include everything that just realized, maybe we didn't touch on enough in the original one. So continue with the new one. If you go to continue with the original one, if you go to the new one, you do have to restart at the beginning. Just like, when you first joined, every lesson is locked. They all build off each other. So you do need to complete a lesson before you can move forward. However, this person was asking about still having access to Melinda's mindfulness and meditations. So you can start the new one. And before you get to Melinda's new sections, which has a lot of great additional information compared to the original one, you can hop over to the original one and listen to them because you've already done them. It's already all on lock. So you can listen to it while you're going through the new one. And also all of the original ones are still in the resources section under that mindfulness meditation folder, which we only recommend listening to after you have completed all of her section, because there are a lot of different things that you need to learn before listening to them. So you can always listen to them while you're starting the new one also, if you want to, get to Melinda's section. I don't know if anyone wanted to add anything to that.
Yeah, just the idea is that you have access to both courses.
Mm-hmm.
You're not going to lose anything. You just have access to both, right? So any resources, everything, it's all part of the same thing. If you have a Concussion Fix membership, you have access to everything that's inside there, including both versions of the course. Now, the people that started after the launch of 2.0, they only have the 2.0 version.
Yes.
The people that were already, we didn't want to take away the 1.0. So anyone who was in the program prior to the launch of 2.0 has access to both versions. Now, what I will say is that one thing we've learned in doing this over the past 5 years is that oftentimes people will get to the end of the course and still have some issues. All that means is that you still have some issues. Some of those issues have not been addressed fully. So what we always recommend is you just go back to the start and you do it again, because now you're coming at it from a completely different place, right? When you're doing it at the start and your symptom score is 90, you're only able to take a certain bits and pieces of that information. But now when you go back to the start and you're at a 30, you're a completely different person. So you're going to pick up more things now that are going to start knocking those off. And we've had people that have gone through the program 3 or 4 times before they actually go, oh my God, it finally clicked and I'm like better. So if you are close to the end and you're still having issues, I would say finish up what you're doing. You're not going to lose anything, so don't worry about it. Then go and you still have some symptoms, go back and start 2.0. It's a completely different program, so you're going to hear things in a different way that you haven't heard before. There's brand new information that you wouldn't have gotten yet. And then you're also going to get another run at it while you are a completely different person than you were the first time through. And that's just going to be what feeds forward. So that's what I would say to anyone who's kind of like almost done the original and not wanting to start at the start. Don't. Get to the end of this one. And if you still have any lingering issues, go back to 2.0 and start there and just do one more run through it. And that'll probably be enough for you, right? Because the fact that you still have the ongoing symptoms doesn't mean that, the program didn't fully work for you. It just means that there's still issues that you haven't fully addressed yet. They're all in there. So you just have to go back and kind of do it again to figure out what pieces are missing, right? What have I kind of stopped doing? What have I given up on, right? What have I not fully implemented maybe the first time around? Because you're going to forget things. Some things are going to fall off, right? And you go back through it again, add those pieces back in, and all of a sudden, boom, now everything's kind of rolling in concert. That would be my advice.
Perfect. One last question here. With my kaleidoscope issue, do I need to see a particular vision doctor? I have also persistent headaches on the top left side of my head.
Kaleidoscope issue?
I'm assuming like the vision. I know sometimes members describe it kind of as a kaleidoscope.
I mean, is it like visual snow, I wonder? I mean, yeah, you should probably, if you're having those type of weird visual symptoms, you should get your eyes checked out, preferably a neuro-optometrist. They're just going to have a better kind of understanding of things like this. You're going to want to look at like the health of the eye, make sure there's nothing going on with the eye itself. And then I would say what you're looking for would be, with migraines. Okay, I saw her. She just commented again. They say it goes with migraines. So it sounds almost like you're having migraine with aura. So when you have like a little bit of like a scintillating kind of color pattern that may happen, or maybe you lose part of your visual field and then you get a headache after. Okay, so that's kind of migraine headaches. Migraine headaches are associated with, we don't really fully understand them, but the latest theoretical framework is that they're kind of similar to concussion in a way, where you get this hyperactivation of the nervous system followed by like a spreading depression type thing that causes a headache. Some theories are that they're vascular in nature, but it's, kind of mixed. Now, so what you're saying here, I'm just reading this again. You say you've never had migraines before. Are you getting migraines, or are you just getting the aura without the migraine? For everyone listening on the podcast, we're just chatting through chat here. That's why you're not hearing her side.
I've never had migraines before.
Yeah, so I'm trying to see, like, is she having migraines now, or is she saying I've never had migraines before,
Constantly.
but now I'm getting them? it's a constant headache. That's not typically migraine. How often does this aura happen?
She said it varies.
Yeah, I mean, it's hard to answer that without some of that context. Yeah, I mean, first of all, see a neurologist. First step, always, whenever there's any sort of pain that's in the area after you hit, is there anything actually impacting locally structure on an anatomical, even like a bone level? Number one, so like MRI. Number two, then you're looking at a neuro-optometrist, like Dr. Marshall said. They're the ones that are going to be looking at eye function, and if there's any sort of dysfunction in eye movement, they will also look at things like acuity of your eyes, and they can give you some insight on any sort of kaleidoscopic symptoms that you might be having. If it's always associated with headache pain that is increased, that is now more along the lines of a migraine, and it could be an atypical migraine. It's possible. It could also be like a cluster headache, which is usually much more severe, very localized, one-sided. This started happening less size. Yeah, that's very much neck related. If you're falling on your shoulder, jamming up some of the nerves, the brachial plexus runs out of the neck, goes down through the shoulder. And also when you fall, there's a huge neck component that happens. So you could have some referral pain to an area of your head, even though you hit your head there, it could be made worse by that. So there's a lot of things that you have to kind of work through here in order to kind of get to the bottom of this. But hopefully that gives you some things to start on.
That is all the questions for today. So hope everyone has a fantastic day. Bye.
See you later, everyone. Have a great day.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.